We will talk about the major muscles of the body. These are the ones that you were working on memorizing, not only their location so that you could label them, but also on their spellings. And then we will also look at the movements or the actions of the muscles. Muscles are named for nearby structures. So the femoris, because the femur, the large bone there, sizes, gastrocnemius, shapes, it kind of has a belly shaped, or its function. These are the ones that we hopefully, or that you hopefully looked at and are working on being able to label and being able to spell. This is from the body of the back view. And here are the muscles. Some of them we can see for both views, but other ones we can see better from this view. So we are pointing those out at this time again. The actions of the muscles. So these are their movements. Flexion is to decrease the angle. If you have your arm extended out and you bend it at the elbow to bring it in towards your body, that's flexion. And you're standing up straight and you bend your knee so your foot goes to the back, that's flexion. And you've bent your arm and you've bent your knee, and to get it back to the straight, if you want to call it, we will use extension to increase the angle of the joint as we open the arm out, and with our leg being bent up when we straighten again, that is extension. Adduction is to move the body part closer to the midline. So if our arms are out to the side, we adduct them in. If our leg is kicked out to the side and we bring it in, that is adduction. If you want to call it a little mnemonic, maybe adding it to the torso of the body. On the other hand, abduction or abduction is to move it away. So when you're standing and you extend your leg to the side, or you're standing and you extend your your arms to the side, that is abduction, and your adduction brings it back in. We talked about that pivot joint of the radius and the ulna. When we're turning our palms down, that is pronation. As we turn them up, that's supination. And a little mnemonic here is, if you could hold your fingers up a little bit and you could hold bowls of soup. The next two motions talk about the ankle. So if you have your knee bent and you've got your foot straight and you put the toes downward, that's plantar flexion. But if you bring your toes up and close that angle, that's dorsiflexion. So dorsiflexion is bending the toes up, where if you're pointing the toe, that is plantar flexion. We also have rotation, right? Our shoulders, we can roll those around. We can take our hip joint and make circles with our legs. So you will be expected to be able to describe these actions, or if an example is given, you could label it or choose the name. So we will briefly go through these muscles. We'll start with the head and neck. The masseter that you need to know closes the jaw. The sternocleidomastoid, here again, remember that pivot joint between the atlas and axis? Well, we can turn our head from side to side. We can also flex the head and neck. We can kind of put our chin down or put our chin up towards the sky. Looking at the trunk, in the back we have got the trapezius, the muscle back there that raises, lowers, and adducts the shoulders. Then if we come to the front of the torso, the rectus abdominis, sort of through the center, but that helps flex our vertebral column, right? We can lean to the right or lean to the left. It also helps bring in or compress the abdomen. The external obliques are on the side of the trunk, and here again, those can rotate and flex the vertebral column. So we can, kind of push our shoulders left and right. Our vertebral column goes along with that, or, tilt it towards the left or right. This also can use to bring in or compress the abdomen. Looking at the shoulders and arm, the deltoid muscle is the one at the top of the arm, the one, and it's a deltoid shape, and it is used to abduct the humerus. This is also important to medical assistance because we will use this as an injection for intramuscular. The pectoralis major, the chest muscle, flexes and adducts the humerus. The latissimus dorsi are actually in the back, but these extend and abduct the humerus as well. And then, of course, we've got our infamous antagonist here, the triceps brachii, toward the back, which is what we use if we've got our elbow bent to straighten it. And then, of course, as we mentioned before, the opposite direction flexion of the forearm are the biceps brachii. The muscles of the hip and the leg. Well, the gluteus maximus is that big one that we sit on, and that's used to extend the femur. So we kick the leg out to the front. The gluteus medius is a small muscle above that, sort of around your waistband, especially now with the little lower waistbands, and that is used to abduct the femur, to do it out to the, put it out to the side. Also, this is an intermuscular injection site as well. Then moving down the leg, we've got the rectus femoris. That's the large one through the center. This flexes the femur and extends the lower leg. Off to the outside, we have the vastus lateralis, which also flexes the femur and extends the lower leg. And this is a site of injection, especially in infants. And finally, the last one we're looking at is the gastrocnemius, and that's the calf, that's the back of the leg, which is used to plantar flex the foot, to point the toe. So this is a brief overview of the muscles that hopefully you are continuing to work on their spellings and learn their locations.